Politics. Chapter 2. Role of the government in health. Question 1. WHO stands for A. Whole Health Organized, B. Working Healthy Organization, C. World Health Organization, D. Working Healthy Organized. Answer, C. World Health Organization. Question 2. Health means A. Our ability of remaining free from fever, B. Our ability to remain free of illness and injuries, C. Our ability of not having any disease, D. Our ability of remaining free from any injuries. Answer, B. Our ability to remain free of illness and injuries. Question 3. If a hospital cannot provide timely medical treatment to a person, it means that which right is violated? A. Right to medical treatment, B. Right to information, C. Right to health, D. Right to life. Answer, D. Right to life. Question 4. The blank is a chain of health centers and hospitals run by the government. A. Urban health service, B. Public health service, C. Private health service, D. Rural health service. Answer, B. Public health service. Question 5. Healthcare facilities divided in two categories. A. Public and private, B. Rural and urban, C. Primary and secondary, D. Small and large. Answer, A. Public and private. Question 6. In India, is in a situation where A. Private services and public services are decreasing, B. Private services and public services are increasing, C. Public services are increasing but private services are not, D. Private services are increasing but public services are not. Answer, D. Private services are increasing but public services are not. Question 7. In which year the Kerala government made some major changes in the state? 40% of the entire state budget was given to panchayats, A. 1995, B. 1996, C. 1998, D. 1997. Answer, B. 1996. Question 8. What was the original full name of UNICEF? A. United Nations International Children's Emergency Fund, B. Union Nations International Children's Education Facility, C. Union Nations International Children's Emergency Facility, D. United Nations International Children's Education Fund. Answer, A. United Nations International Children's Emergency Fund. Question 9. Which organization provides blood to an ill person? A. Medical store, B. Dispensary, C. Hospital. Answer, D. Blood bank. Question 10. OPD stands for A. Outpatient department, B. Out primary department, C. Out public department, D. Out private department. Answer, A. Outpatient department. Question 11. Which of the following is not the communicable disease? A. Tuberculosis, B. Diabetes, C. Malaria, D. Cold. Answer, B. Diabetes. Question 12. India is the blank largest producer of medicines in the world and is also a large exporter of medicines. A. Fifth, B. Fourth, C. Sixth, D. Second. Answer, B. Fourth. Question 13. A disease that attacks a large number of people in an area at the same time is called an A. Germs disease, B. Epidemic, C. Non-communicable, D. Communicable. Answer, B. Epidemic. Question 14. These are diseases that are spread from one person to another in many ways such as through water, food, air, etc. A. Non-communicable disease, B. Germs disease, C. Bacteria disease, D. Communicable disease. Answer, D. Communicable disease. Question 15. PHC stands for A. Primary hospital centers, B. Primary health care centers, C. Public healthy centers, D. Prime human centers. Answer B. Primary health care centers. Question 16. PBKMS stands for A. Pashambanga Ket Mazdor Samiti. B. Pashambanga Kalyan Mazdori Sang. C. Primary Banga Ket Mazdori Samiti. D. Primary Banga Kalyan Mazdor Sang. Answer D. Primary Banga Kalyan Mazdor Sang. Question 17. On which of the following does our good health depend? A. Clean drinking water. B. Pollution-free environment. C. Hygienic food. D. All of these. Answer D. All of these. Question 18. What should be changed weekly to avoid breeding of mosquitoes? A. TV sets. B. Water in coolers. C. Rooftops. D. None of these. Answer B. Water in coolers. Question 19. How much percentage of all communicable diseases are waterborne? A. 11%. B. 21%. C. 31%. D. 50%. Answer B. 21%. Question 20. Which one of the following is a communicable disease? A. Headache. B. Cancer. C. Sore throat. D. Diarrhea. Answer D. Diarrhea. Question 21. Which type of healthcare facility is costly? A. Private. B. Public. C. Both. D. Both or same. Answer A. Private. Question 22. Tax money is used to fund which of the activities? A. Education. B. Defense. C. Police. D. All of these. Answer D. All of these. Question 23. By whom are the public health services run? A. Government. B. Private organizations. C. Private doctors. D. None of these. Answer A. Government. Question 24. What does PHC mean? A. Private health center. B. Public health court. C. Primary health center. D. All of these. Answer C. Primary health center. Question 25. What does RMP mean? A. Registered medical practitioners. B. Retired medical practitioners. C. Recognized medical practitioners. D. All of these. Answer A. Registered medical practitioners. Question 26. Where are medicines sold? A. Dispensary. B. Medical stores. C. Government hospitals. D. None of these. Answer B. Medical stores. Question 27. What percentage of people can afford required medical care? A. 10%. B. 20%. C. 30%. D. 40%. Answer B. 20%. Question 28. Good health depend upon A. Health care facilities. B. Basic amenities. C. Social conditions. D. All of these. Answer D. All of these. Question 29. What percentage of state budget is allocated to Panchayat in Kerala? A. 10%. B. 20%. C. 30%. D. 40%. Answer D. 40%. Question 30. In which continent is Costa Rica situated? A. South America. B. North America. C. Australia. D. Asia. Answer A. South America. Column A1. 40%. 2. 20%. 3. 15,060. 4. 18,218. Column B. A. New doctors a year. B. People afford all medicines. C. Hospitals in India. D. Borrow money for health reasons. Answer. Column A. Column B1. 40%. D. Borrow money for health reasons. 2. 20%. B. People afford all medicines. 3. 15,060. A. New doctors a year. 4. 18,218. C. Hospitals in India. 1. It is the responsibility of the to provide proper healthcare facilities to all. Answer. Government. 2. Is one of the healthiest country in North America. Answer. Costa Rica. 3. The resources needed to run public health services are obtained from. Answer. Taxes. 4. In Kerala, percent of entire budget is given to panchayats. Answer. 40. 1. Blood required for a patient is generally available at medicine bank. Answer. False. 2. Hakim Sheikh was denied treatment at the government hospitals. Answer. True. 3. RMP means rural medical practitioner. Answer. False. 4. Diarrhea is a waterborne disease. Answer. True.